Hello to the second video in this online course on public health ethics. Today we're going to talk about the roles of healthcare practitioners, the technical and the ethical differences, if you like, between the clinical care and public health practice. We are going also to touch on the definition and the taxonomy or the classification of ethics. So we're going to be introduced to what do we mean by ethics, what is an ethical issue, bioethics, clinical ethics, research ethics, and indeed public health ethics. Then we're going to end with an emphasis on the importance of ethics in our practice as public health practitioners, in terms of our practice in research and policy. Referring to the CanMed model, and you will find the full reference in the references list, there are many roles for us as healthcare practitioners, including us as public health practitioners, i.e. providers of a service. We are also expected to be researchers, educators for our colleagues, even for the public as health educators or as teachers or medical educators, if you like, as a counselor, so that we provide advice, informed advice for our clients. And by clients I mean not only the patients but also the health individuals, and as we'll come to in a minute, that our role as public health practitioners is more towards prevention rather than cure. Then there is our roles as managers or administrators, as well as advocates for the community's rights and for our patients' rights as well. So these are the key definitions and concepts that we're going to be dealing with today. What's public health? What's ethics, bioethics? What's public health ethics? If I ask you to present to a normal person, a lay person who has no specific training or specific knowledge about health and health-related issues, how would you define public health to him? Think about it, give yourself a minute, and probably you'll be asked to submit this as a very short and easy to submit assignment. Usually, most of the people in our communities, and I believe worldwide, when they think about healthcare, they are thinking about clinical practice or doctors in hospitals treating patients. However, it's important for us to, when we try to explore the public health ethics field, to compare it in a way to make a comparison between clinical practice and public health practice. So in clinical care, usually doctors try to seek cure for their patients, while in public health we tend to prevent healthy individuals from getting ill in the first place. So versus cure, we're looking for prevention. In clinical care, usually doctors target individual patients usually, or sometimes healthy, and their families. In public health, our target is the whole population usually. The scope in clinical care is about the clinical care, diagnosis and treatment, while in public health, our interventions are usually devoted to health education, health promotion, and other community-based interventions. The specialties in clinical care include, for example, internal medicine, surgery, pediatrics, or obstetrics, etc., while in public health the fields are like epidemiology, health education, health promotion, biostatistics, environmental health, occupational health, etc. The kind of guidance provided for the clinical care practitioners, or doctors and nurses, are like the clinical guidelines, hospital policies, and some laws and regulations. In public health, usually we have our own guidelines, again with some regulatory regulations and laws. It's important to note here that it's not only at the level of the country. We're talking also about the international health regulations, which are applied on regional and sometimes international levels. So, what kind of ethical issues that we encounter in clinical care? For example, issues related to autonomy, the patient's right to decide for themselves, the issues related to privacy and confidentiality. The issues related to the tension between the individual rights and the public good are usually the main source, as we will come in a minute, of ethical issues in public health. For example, when is it ethical to limit the freedom of movement of persons? For example, in a case of an endemic or a pandemic. Do parents have the right to refuse vaccinating their children? And we will have a separate part of this course related to the issue of vaccination. What could be the sources of ethical tension in public health? First, we have sometimes contradicting rights, the public rights to stay safe and the individual rights, for example, the freedom of movement. The scarcity of resources, as we all know, it's never, in whatever country, it's very rare that we find enough resources for everyone. There are also issues related to the socio-political factors, especially in our region. For example, the issues related to poverty, illiteracy, the issue of minority, and the other kind of vulnerabilities. There's also the issue of abuse of power in terms of the nanny state, that the government is so powerful and it imposes its own regulations on the people, all the people. There's also the issues related to public engagement. To what extent are the people really engaged in meaningful engagement in public health policies? There are issues related to the social culture factors. For example, in some communities there are local beliefs, the national guidelines about something or the international guidelines about something. To what extent can we strike a balance between what the local community believe and what are the national guidelines say, or even the international guidelines say about something? The role of families and community leaders. As we all know, at least in our region, we have a very strong hierarchy, very strong structure, community structure, to the extent that some community leaders, whatever they say, whatever they tell the people to do, it is likely that the members of this community will follow their leaders without necessarily being a voluntary decision. This could be a source of ethical tension. There are also the issue of urgency to contain public health threats, whether in case of an endemic or a pandemic. As public health practitioners need to act fast, to the extent sometimes raise ethical issues related in terms of when to give priority to the urgency or to the need to act fast versus the rights of the people in the community. There are issues of inequalities between whether within the same country or between countries.